Thank you, Dr. Clifton, and thank you all for being with us today. I've been at Hopkins for more than half my life now, so I'm a big fan of this place, and there's never been such a more exciting time, I think, to be here. And I sort of wish I was redoing residency with all the great sort of efforts that Dr. Clifton and her team have made here. I'm going to talk about an issue or a program that is, I think, near and dear to everyone's heart in our department, not only in our department and our institution, and to our residents, several of whom helped me raise the funds to be able to do this program. And it's a community partnership in prostate cancer. And I think it's sort of nice to discuss here because we're doing a lot of community partnerships, but this specific program, I think, makes a nice story of what is special about our department today. So why is this important? We all know that compared to white men, Black men are more likely to have prostate cancer. They're more likely to have aggressive prostate cancer, and they have worse outcomes. And in any effort to narrow these gaps will help all prostate cancer patients. So, this is a New York Times article about prostate cancer isn't colorblind, showing some of the sobering statistics that afflict a Black man compared to non-Black peer with excess rates of diagnosis of prostate cancer. And then we know that this is multifactorial why this happens. Some of it may be biology, and so there's scientific efforts that need to happen there. But a lot of it is institutional, structural, and systemic in nature, socioeconomic status, food islands in certain communities. And we know that when Black men are diagnosed with prostate cancer, they're less likely to get aggressive state-of-the-art treatment. So this disparity is real. These disparities are prevalent from screening to diagnosis and all the way to treatment. And this is a signature disease for us here at the Brady, prostate cancer. So again, more of a reason for us to be involved in this effort. As we all know, and Dr. Parton sort of showed some of the histories, the Brady's been around for more than 100 years, and a lot of innovation has happened here. Radical prostatectomy was first done here. The nerve-sparing radical prostatectomy was first done here. Hypothermia and cardiac arrest for renal cell carcinoma by Frey Marshall. Prostate cancer nomograms with the Parton tables. Hereditary prostate cancer in a landmark New England Journal article by Dr. Walsh and Dr. Isaacs looking at HOXP13. The laparoscopic donor nephrectomy was the first such case done in the world in 1996. So a lot of great discoveries. And here we are in this community in East Baltimore, a predominantly Black community. And I think the time has always been there, but more so today, there's an urgent call for us to be involved in efforts to decrease these disparities and study this problem. So to that end, a couple of residents and myself and a couple of other faculty members went to a very kind and generous family, the Schaffelds, and we talked to them about a program to study and to help bridge this gap in prostate cancer in Black men, specifically in our community in East Baltimore and in the National Capital Region. And the program is pillared by education. So you guys are applying to residency, so this is very, very relevant, and community outreach, community partnership, I like to call it. And that is a very substantial effort in education, health literacy, healthcare delivery, promotion of informed decision-making. This is not to go and screen a bunch of men, but to discuss whether they would like to be screened and what information is out there. What is a prostate healthy diet? What are the state-of-the-art treatments? What are the side effects, et cetera? And of course, to do what we do best at Hopkins, which is scientific inquiry. So that's a big pillar, as well as precision medicine, which is a big initiative here at Hopkins through the Dean's Office. And we have two of the precision medicine centers of excellence in our department, one of them in prostate cancer, the other in bladder cancer. And Armin Smith, Jeannie Hoffman-Sensis, and others are very interested in community programs amongst women who have bladder cancer, a discussion for another day, but another area that we're very heavily invested in as well. Our team leaders for this program are myself and Dr. Tamara Lotan, who is in pathology and also urology and oncology, and Dr. Otis Brawley, who spent about more than, I think, 10 years being the vice president and chief medical officer of the American Cancer Society, and one of the biggest voices and thought leaders in healthcare disparities, especially prostate cancer. And our community outreach efforts will be centered initially and continue to be in Baltimore City in the 6 or 7 zip codes surrounding our hospital. The middle graph here shows you life expectancy in Baltimore City. And the further away you go from East Baltimore, the higher the life expectancy. And the lowest of the life expectancy is actually in our community due to violence, but also due to excess deaths in prostate cancer. Wards 7 and 8 in Washington, D.C., you could see there are also two very important parts of our community outreach, and they are very sort of geographically close to our Sibley Hospital there. And then we have an outreach effort in the Eastern Shore of Maryland in some of the communities there. And how do we do this? Well, we do this through community health innovators, who are trained to address health equity and social determinants of health. And these are partnership efforts with Otis Brawley's group, but also through Johns Hopkins Community Physicians, which is the largest primary care network of physicians in Maryland. And our residents have been very interested in this and will be helping out. There's a picture of Dr. Parton, Dr. Carter with some of our ex-residents. And the idea is to have residents go out into these community physicians' offices and help with information, literacy, in any really health-related outreach. And we all have to remember that a prostate healthy diet is actually a heart healthy diet. So promotion of prostate health, I think, is also promotion of general health as well in our community. There's obviously a lot of scientific inquiry that we've done and continue to done. A couple of examples is Dub Sunday's work. He's a former resident of ours who's now at Ohio State University, looking at the distribution of cancer in white men versus Black men. And you could see that at least in our cohort here at Hopkins, there are more anterior lesions in the Black men. And so the traditional transrectal approaches to biopsy may miss those and may account maybe for some of the later detected cancers, but an important discovery that we'd like to make more of these scientifically. This is a study by Dr. Farzana Faisal, who just graduated our program, working with Dr. Lotan, looking at genome sequencing and identifying some molecular subtypes of prostate cancer in Black men. This is, of course, the work of Billy Isaacs and Pat Walsh, who are pioneers in hereditary prostate cancer, trying to identify candidate genes that may be more relevant in the Black population, which would give us a lot more insight biologically as to why these are happening and what we can do. But our bench is deep. I mean, when it comes to studying the science behind this, we've got biomarkers, genetics, epigeneticists, experts in treatments. Karen Spanos in the bottom panel there is an expert in the microbiome. Elizabeth Platts next to her is a public health and epidemiology expert who's interested in diet and all sorts of things related to prostate cancer. Jonathan Epstein, Dr. Parton. So really, we hope to use this deep bench to help with the scientific efforts, which I think is what we do best. But I think this community effort is going to be what we end up doing best as a result of this program and others. So education is a big pillar of this, and resident education in particular, but also medical school, post-baccalaureate programs. So we're currently funding multiple post-bac underrepresented minority students who we would like to get them exposure in prostate cancer research and in urology in particular, and to also help them get into PhD programs and MD programs after their stint with us. And our residents are heavily involved in mentorship and partnership with these students. Hopkins is a model in education, being sort of the model for the world in 1910 per the Flexner Report, which a lot of medical schools are modeled after Johns Hopkins. We're also, late to the game, I think, but still early when it comes to American institutions in terms of female medical education. We were amongst the first medical schools to admit women, and I'd like to say it was because of good nature, but it's because of a philanthropic contribution by Mary Elizabeth Garrett at the time, and a stipulation that women be admitted to the medical school. And of course, Dr. Levi Watkins was the first African-American intern in surgery in the entire country. And to me, it's jaw-dropping that that was in 1970. So we've come a long way, but we hope to even go further in 2021 and beyond. And as Nelson Mandela said, education is the most powerful weapon which you can use to change the world. And we in the Brady not only believe that, but we want to live that. And so we want educational opportunities at all levels. We hope that this program will be a partnership for change and help us yield discoveries that improve care and reduce disparities for prostate cancer. But you can take prostate cancer and substitute it with, as I said, bladder cancer with the effort that Armin is doing. And I know that there are other institutional and departmental efforts that we hope you all and future generations will be a part of.